What's going on, everybody? Welcome to the eAssist Dental Billing Academy videocast. Super excited to be with you. And this is going to be a blast. There are so many great people, eAssisters, we'll call all of you, right, that are out there helping dental practices all over the country, certainly making a difference. My name is John Stamper, and what we're going to do with this video cast is bring on a lot of the eAssisters and have them share with you some of their stories, right, so that you can relate to what they deal with and things to learn. And most importantly, I think showcase some of the great work they're doing. So very excited for Jackie Koontz with us from Phoenix, Arizona. What's up, Jackie?
Hi, how are you?
I'm doing wonderful and such a pleasure. I know we were kind of chatting a little bit before. I was noticing the rainbow unicorn behind you, which is pretty cool. I like the unicorns are in right now, right?
My son loves them. So I
Yeah.
have tons and tons of pictures of unicorns all over the house. This is where he deemed he wanted the unicorn put on into my office. I have another one on my window over here on the side. So
Perfect.
yes.
Awesome. All right. I see them everywhere, right? Like everybody's just kind of like, it's like they're coming back, like they're brand new or whatever. All right. So share with everybody a little bit about your story.
Well, where would you like me to start?
I think you had said eAssist about 5 years, right? You had said you've really done anything and everything as the company's evolved and things like that. So, maybe start what it's been like from there to now.
Sure. Yeah, I found eAssist about 5 years ago. And like a lot of folks back in those days, working from home is not nearly as popular as it is now. So the opportunity to do dental billing, which I loved from home, I was skeptical. So I kind of took the leap and started a little bit part-time and to figure the company out. And then about a year after I started part-time, I went to something called our summit. And that's where all of the eAssisters throughout the country come once a year. We get together, we talk about the company, we talk about improvements. And at that time, that was the first summit. It was really small. There was probably less than 50 people there. And I've just connected with the company at that point. I connected with everybody else, all of my other, I like to call us insurance nerds. We're a bunch of insurance nerds. We love everything about insurance and really helping grow eAssist. So that was me falling in love with the company, and I took the leap very shortly after that to go full time. Since then, I still am an independent contractor as a lead on an office, working insurance claims, correspondence, posting payments, and working aging. So I still do that, but I've also done office launches. So back in the days when I did it, they were called team leaders. They're called connection coaches now, and I still am involved in that. So I still help offices launch new offices that come onto the platform. I've also been a Kaizen coach, which is relatably termed as like a regional manager.
Yep.
So I've been that as well. I've worked in the IT team. I've probably done every single job with eAssist at this point, but it's been great because I have additional insight into those other departments, and I'm usually able to help facilitate either conversations or just problem solve. So it's really nice. And overall, because of that experience, I've had the opportunity to grow both professionally and personally. For example, in a dental office, I felt like I was kind of at my end, right? I was at an office manager. I had reached the top of wherever I was going. Whereas here, I've had leadership opportunities that I never would have even been presented to me before that. And having those opportunities has really been a blessing.
Yeah, I love that. I love that. And so, all right, probably this is what everybody wants to know. When you look at the role that you guys play and all the things that you've done, share with everybody your worst claim story.
How do I pick? Gosh. So I had a patient come in. She was an elderly patient, and she came in to have a couple of her veneers placed. So she had 2 veneers on her 2 anterior teeth, and we had replaced them with crowns because even though it looked like they were veneers when they were originally prepped. It was too much of a prep. So there wasn't really enough tooth structure left to do replacement veneers. So we did crowns. She literally had popped them off. They were gone, completely lost, no other replacement. So her insurance comes back stating that it was an unfavorable prognosis. And I'm like, what, y'all, what would you have expected us to do? Do you want her running around without any sort of restorations on her front teeth? So
Right.
I immediately went to the angle because I wanted she was either in her late 80s or early 90s. So my
Wow.
first red flag was, this is ageism, right? Like they're saying it's an unfavorable prognosis because she's so, late in her life that maybe
Right.
they don't,
Right.
That being said, I called them out for that particular scenario. I said, the only other um, thing that I'm thinking that you guys are denying it for is because of her age, which, you really can't make that determination. You've never seen the patient.
Mhm.
Your job as an insurance company is to pay on claims, not to diagnose treatment.
Mhm.
And then they paid it. But reading between the lines and, again, calling insurances out, because they are doing this now. They're trying to diagnose and they're saying, well, that's an unfavorable prognosis. Well, you've never seen the patient before in your life. Like
Right.
you're going based off of a 2D image of an x-ray rather
Mhm.
than, that's a disservice to your client and our patient.
Mhm.
So, I say it a lot on our intercommunication throughout eAssist. I try and give my little paragraph that I add to those appeals because it's wrong. It's not right. So we're really
Yeah.
there for the patients as their advocates.
I think that's what's so interesting about what you guys are doing at eAssist is that you have to think, Jackie, that there was a time with these insurance companies where they would make those decisions, maybe because there wasn't people out there that either were educated about all of the variables, right? Knew what questions to ask, knew how to present it in a way. And then it seems like once, like you said, you were able to share with them what the situation was, then they did accept it, right? But it certainly was a long journey.
It was, and I had to submit a complaint to the insurance commissioner for the state because of that one,
Yeah.
because they were trying to give me the runaround and say that and it's not like I didn't present this information to them when I initially submitted the claim. They were just trying to drag it out
Mhm.
and you know keeping them accountable, because they're not there to diagnose. They're not
Right.
clinicians. They usually have consultants that review the claims and make those determinations. But is that right? No.
Mhm.
Um, and a funny thing about eAssist that's kind of changed the world of insurance is they've caught on to us, being the offices and the patients advocates,
Right.
and they've started refusing to talk to us. So we'll call and they're
Yeah.
like, do you work directly with the office? And we say yes. And then they go, well, your phone number doesn't match up with the office. We're not going to
Interesting.
talk to you.
Interesting.
Right. So
Yeah,
yeah.
that's progress. That is progress, Jackie. I
Yeah.
love it. I love
Yeah.
it. All right, let's talk a little bit about maybe a difficult situation that you were able to rise to the top of the challenge. Figure it out, and maybe share a little bit, kind of the process of what that was like and how you were able to do that.
So one of the things that eAssist is built off of, one of our core values, is something called the message to Garcia. The message to Garcia, it's an old fable that is essentially a story of someone being given a task with no instructions, and no sort of guidelines on how to complete those instructions, but finding a will and a way to finish the task, is kind of like the shorthand version of that. So it's one of the biggest principles within eAssist, and if you don't have that drive, then it's really hard to be successful in the company, just because we're a bunch of problem solvers. We like being able to figure things out. So with that being said, one of the earliest challenges that I came across, this was a few years ago as a team leader to launch a new office. They came through, and the office, I'm doing an internal assessment, looking through their numbers, and the doctor has $12 million in over 90-day aging. And so, right, right. This is one of the first cases that we saw of this. We've seen a lot more since then, but this was one of
Yeah.
those first cases. And I literally went, I have no idea what I'm supposed to do. I don't know how to help him. That's a
Right.
ton.
Right.
So after talking to him, I figured out that he had never entered in a payment into his practice management system ever. He was literally sending claims, receiving checks, going to the bank, and calling it a day. So what I ended up doing was I came up with a separate service agreement with him in order to clean things up, because again, we're talking about a claim from 10 years ago that had already been paid. There's no way for us to be able to track that down, nor would it be a fruitful investment for anyone to track down that information. So
Right.
I came up with a separate agreement for him to do a cleanup. So to clean out all of those claims that were over 2 years old that were still sitting in the practice management system, just clean them off, adjust them off, and then we'll try and move forward. And so, we did that. The team started, they started working the claims that were under 2 years old.
Right.
And that was several years ago. I think they've finally gotten to where he's current because of all of
Wow.
that work. But he's still a happy client. He's still here. He's still happy. He absolutely loves us. His team loves him. It's a great mutual collaboration. But yeah, that was a shocker. I remember just going,
Yeah.
I have no idea what I'm supposed to do here.
Right.
And so
Right. Yeah.
yeah,
That's kind of a big number. You're like, holy
it
cow.
was
Yeah.
huge. It was
Yeah.
absolutely huge. None of us had ever seen anything like it before. But like I said, we have encountered those since then. So
Yeah, yeah, and how much confidence you breed. So that's awesome. All right, so let's talk a little bit about where and I guess when you feel most accomplished, right? You feel most satisfied with what you do, and then talk a little bit about what gives you that satisfaction.
Uh, my satisfaction from today versus a few years ago is different. So I'm going to go
Yeah,
off of what's
yeah,
today.
yeah,
Right now, my biggest satisfaction is fulfilling clients, their concerns, right? So they'll usually come in and their office is blown up, right? So imagine walking into a hoarder's house. That's a lot of times what we encounter. We encounter a lot of, misorganization or just, clients feeling lost. And to hear a client say, I feel so much better. I love my team. You've made such a huge difference for me, makes my day. Like I just kind of like ride on that. But also helping our eAssisters. So helping our other eAssisters is really important to me. Anybody who's watching in the company probably sees me all over Zulip. Like I'm constantly answering questions and trying to help people out because I've been there. I know how scary it is and how you feel alone on an island sometimes because you're at home and you don't necessarily know who to reach out to. And so any sort of help that I can provide for somebody else to at least try and make their day a little bit better is one of the things that gets me through. And it's really important.
Well, I just put on the screen so that everybody can see. You were also the August 2019 Caught Caring Award winner.
Yeah.
Congratulations on that.
Thanks.
I love that title. I was like, Caught Caring, as in code for, you're doing your thing, and certainly somebody recognized what you're doing. And I think it goes along the lines of what you just said, right? Which is always wanting to grow, learn more, things like that. So again, congrats on that. And
Thanks.
that leads me to my next question, really, which is, you and I talked about you being a dental assistant, right? Is that what you're saying? At one time, you did
Yes.
that, and like many people have shared, and many successful people in dentistry have said, "Hey, listen, started as a dental assistant, wasn't my thing. Now I'm in a place where I'm certainly thriving, and so on and so forth." But can you talk a little bit about what led you to this work and what you like so much about it?
So eAssist wise or insurance wise?
Yeah,
Or both?
let's can you touch on both? Yeah,
Yeah.
I think it'd be good to
Yeah.
kind of
We can
share. I
touch
think
on both.
there's value on both of those. Yeah.
Okay. So insurance, I am not good with not feeling like I'm doing well. Like I'm one of those people who I want to do well in something. And so as an assistant, I knew the material. So I knew, from a clinical background, all of these different things. But being a dentist right-hand person and having him rely on me and feeling like I'm failing all the time is just really hard for me. And so I still wanted to utilize the knowledge that I had about dentistry. And I had always been sort of I was a hostess before, so I did, sort of time management and scheduling. And so
Mhm.
I just kind of naturally gravitated up front,
Mhm.
because answering the phone and being able to answer someone's clinical questions or just general questions about a procedure is helpful for the front desk. So it's good to have a clinical background. So I slid into that really easily. But again, and to go back to one of our staples of eAssist is also part of always be growing, right? Growing and
Mhm.
improving yourself, Kaizen.
Yep.
And
Yep.
so that's been before I even knew what Kaizen was, it was an important part of me to constantly be able to improve and grow and learn. And I just reached a point with being a schedule coordinator where I was like, well, I want something new. I want to learn something new. I want to keep going. So
Yeah.
I badgered my office manager into learning insurance checks. I think it came down to her going on vacation once, and she was like, all right, I'm finally gonna let you do this. So that was really the start of that process for me.
Yeah.
And it just took off from there. I discovered eAssist because, and a lot of other office managers might identify with this, I just was not, the income wasn't there. I
Yeah.
was doing what I loved, but I just wasn't, I didn't feel like I was being compensated enough, at least, in comparison to my quality of life and, my expenses. I was pregnant with my second child, and I was like, I'm literally going to be paying for childcare just by
Right.
working. Like the
Right.
amount that I was paying for childcare was equivalent to how much I was being paid, and I didn't
Right.
see the advantage. So I sought out and I found eAssist, and again, I tried it very, slow and start, and it took off. I was making as much with eAssist, working part time, as I was working full time in an office. And so I was like, what am I doing? And again, when I went to Summit, a lot of those wonderful ladies, Rebecca Avey in particular, talked about how much she was making, what a difference she was making with her clients in her offices, and it inspired me. So, I am now, I have an independent life. I for the most part, with more leadership opportunities that I take on, the more meetings that I have to be in. But I was able to go on every single field trip for my eldest for
Awesome.
kindergarten, right? And I
Yeah.
would have never been able to do that when I worked in an office, or it would have been this, well, I guess you can go.
Right. Right.
um,
Right. Right.
so having those opportunities, in addition to providing for my family, making just as much as my husband, because we're competitive like that.
I love it.
um,
I love it.
it's just, yeah, it's something that's changed, I think, for the industry for sure.
So I was going to ask you how working with eAssist has changed your life. You just defined it, right? There's really nothing. I mean, you just shared what it has been like. I think all of those examples that you shared, and as you know, everybody's situation is different, but there's a lot of similarities. You're no different than anybody else out there that is raising a family, and you're trying to find a balance between being a mother and working in a career that you really like you mentioned, and things like that. So super exciting. Obviously, it's really helped you change your life. Talk a little bit about people out there that are on the fence, right? Like you were, like most people are, so getting ready to kind of look at a new opportunity or what have you, and they're looking at eAssist and they're saying, okay, is this something that I should do? Share with them a little bit of your insight, that why, and why you think it was important, and maybe what your message would be for them to make that decision and to give it a shot.
So I would say anybody who's considering it, it's a big decision. So it's not something to be taken lightly, but it is something that you can do as a part-time venture to get your feet wet, so to speak. But it's like any other professional job. So you may work from home. That doesn't mean you're not working. So I did still keep my children in childcare. I felt like quality was more important than
Right.
quantity.
Right.
So that was a personal decision that I made. But I know lots of other eAssisters that do keep their children at home and they work at the same time. So kudos to them, because I could have never done
Right.
that. But
Right.
I would just say to anybody considering it, just take it as a serious opportunity. So this is not, it's not only a career opportunity, but it's a personal investment in yourself. You're not working for a dentist anymore. You're working for yourself.
Right.
You do have your personal clients. I've got 4 awesome clients that are, I take care of every day.
Mhm.
But again, they're my clients, and I have that freedom to help them.
Yeah.
It's also important to keep an open mind. When I first started, I thought I knew everything. I was like, "Oh, I've run this office so great. I know
Yeah.
all of it. I'll be able to get in, no problem." And as soon as I got in, I was like, "Oh my, I know nothing. I know nothing that and I immediately went out the door." So, it's also being humble and accepting that you may have been top dog for whatever office you worked in before, but
Right.
going from one state to another is a big one. And then, because I've got two offices in New Jersey, I've got a New
Hmm.
York office, and the other one's in California, right? So I
Wow.
need to know
Yeah.
all three of those states
Yep.
and what those states, require for lots of different scenarios. So, yeah, whatever may have worked for you for your state and your office, it may not be applicable for
Right.
everybody.
It'll be different. Yeah. Well, thanks for sharing that. All right. So, a couple of fun questions. Are you game?
Sure.
Okay. So it's bucket list time, right? Where is a place in the world now that you're doing these things, you're kind of building your own future, which is really exciting, but where is a place in the world that you haven't had a chance to visit yet that you really want to go to?
Oh man. Italy, probably. That's
Okay.
probably or Paris as well, Italy. I just want to do a whole like European tour trip
Okay.
with my husband. That'd be great.
All right. So this one might be a tough one, but you never know if it's on the tip of your tongue. So if you had to drive from California to New York, right? So let's say you had to go see your practice in California and then drive to go see the other one in New York, and you could only listen to one song on the radio the whole way across the country.
Oh no.
What would it be?
Oh no. I don't think that I could do that. I think that
Yeah.
I'm one of those people that's in the car that if I hear the same noise like going over, I go insane. I also am a book reader in the car, so I just listen to my books
Got it.
in the car. But
Awesome.
yeah, I don't think I could do that. Someone would get hurt.
Okay. All right. So the last one is because you don't want anybody to get hurt. Okay. You get your own billboard kind of right there in Phoenix, right? And they come to you, they say, all right, Jackie, if you could go ahead and put a billboard up that was maybe a message that is kind of your, I guess, mantra for your life, right? The way that you like to live or whatever the case may be. And you can have that up there for a month. What would you put on that billboard?
So I have two.
Okay.
One is more time. And the next one is that if you can't do it right, when will you have time to do it over?
Yeah. I love it. I love it. Well, Jackie, this has been great. And again, congratulations on your Caught Caring Award. Super exciting.
Thanks.
It is very obvious why you won that award. This has been a true pleasure. And thank you for sharing your insight for all of those other eAssisters out there as you guys continue to do some great work and push the limits. I love it. I love what you guys are doing and really appreciate you coming on today.
Thank you. It was a pleasure talking to you. It was fun. Thank
All right.
you.
Awesome. All right. Have a great day.
Thank you. You too.